Hi, I was going to share a short story with you today, which is never short, but we'll try. I was thinking about it when I was talking to a friend of mine earlier, and we were talking about what else is anybody talking about these days, the coronavirus. And we were talking about all these cases of coronavirus that are occurring, that are in the public spotlight with the administration and all the different senators, cabinet members, immediate staff, aides of the president that have come down with coronavirus. And my friend, who shares a different perspective than I do, suggested that he thought that there was a conspiracy perchance that somebody was trying to, who knows, take out the president by seeding some area with coronavirus. Now, in his mind, it made perfectly good sense. In my mind, I'm reminded of what I learned a number of years ago in veterinary school, and that was, don't look for giraffes in your backyard. You know, I'm in my 6th decade of veterinary practice now. I've been a veterinarian twice as long as I haven't nearly. And one of the things that veterinarians are really, really preoccupied with are viral diseases. We may as well be the viral guys. Virology, the study of viruses, knowing how to differentiate viruses, immunology, how the immune system works to protect against viruses, vaccinations in order to prevent viruses, and then how often and how frequent they occur and where's the likelihood and which are the viruses that are most likely to happen. I'm going to share a story with you. Back in April of 1980, I was a young veterinarian, hadn't been out of school, it seemed like 15 minutes. And all of a sudden, we were seeing a plethora of cases of dogs. And most of you people are pet owners, dog owners, cat owners. In April of 1980, I can tell you the month and the year and remember it like it was yesterday. We started to see a number of dogs that were vomiting, diarrhea, a lot of times both those turning to straight blood. And then these animals would go into circulatory collapse and they were dying by large numbers. At one point in my small single doctor practice, I was seeing 60 patients a day. Can you imagine? It was like a pinball just bouncing around, 60 patients a day. Most of you guys, like I said, if you have dogs, when you take your dogs to the veterinarian to get your dog vaccinated, you don't really think about it. You think about it, he's getting his rabies shots. That's what they say, he needs his rabies shots. But the shots, what we're talking about, a rabies shot, we're talking about a distemper shot, we're talking about a parvo shot. So the very first time that we saw any parvo in the dog in Tarrant County was April of 80. I was on the phone with the College of Veterinary Medicine, as were a number of other veterinarians, wondering what was this phenomenon we were seeing all these dogs. And they had identified it as a parvo virus. Now, this was the first time dogs had ever been infected with parvo virus. So it is called, or was called at that time, a novel virus, just like this novel coronavirus. So as a veterinarian, our background is very heavily virally focused. Most of the dog diseases, the cat diseases, feline leukemia, feline immunodeficiency virus, feline panleukopenia, feline infectious peritonitis. In the dogs, we have canine distemper, canine parvovirus, they have rabies virus in both of them. So virology is a large part of what veterinarians do. When we first had the, I'll have to give Woody a peanut, otherwise we'll never get this done. When we first had our first occurrences of parvovirus, we called down to the college and asked for some direction and guidance, and they recognized it to be a parvovirus. And they said, you know, cats also have a parvovirus, and in cats, it was called feline panleukopenia. So viruses are classified according to different characteristics. This particular coronavirus, when you examine a virus, you can't look at it under a microscope. You need intense magnification, so you have to use an electron microscope. And under the microscope, the coronavirus has little spikes, little thorns, which is why they call it a coronavirus. So this novel parvovirus in the dog was recognized, and we started using this panleukopenia vaccine, which was for cats, but it was a parvovirus for cats, trying to get some cross protection. So as we saw more and more of these cases of dogs that were dying in large numbers, our treatments got a little bit better. We noticed that these dogs, when they got a significant amount of pain, would go into circulatory collapse, and that's when they would go into shock. And so if we would prevent the pain, then a lot of times we could keep these dogs from going into circulatory collapse. When they did go into circulatory collapse, we realized that if we ran them large amounts of intravenous fluids, our treatment protocol was much more effective. And we also realized if we started using medicines that coated the lining of the intestines, demulcents and things like that to protect that lining, our treatments got better. So with time, the disease itself wasn't any less severe. We just got better at our treatments. And that's kind of what's happened here with the coronavirus. You know, back in the 70s when I was getting my formal veterinary education, that was about the same time that they were first identifying some of these anti-inflammatory compounds that are produced in the body known as interleukins. Matter of fact, the first interleukin was identified in the 70s. And that was in the research institution. So as a veterinarian or a physician that was graduating at that time, they had very little knowledge of what an interleukin was. Here we are now, some 40 years later, and we've identified nearly 40 of those interleukins. And an interleukin is a compound that just happens to be produced in the body, whether it be the liver, the bone marrow, what have you. And it's released at times of infections and inflammatory response. And what happens is if you get overwhelmed, in this particular case with the coronavirus, with an exaggerated immune response, then typically you don't do quite as well. So some of the newer novel treatments for some of these diseases like Crohn's disease and eczema, psoriasis, these diseases have been linked to a deformity in the production of these interleukins. So this technology is totally new to most of the physicians that have been practicing for a long time. Now, trying to explain the whole complexity of virology, the whole complexity of the immune response and immunology, and the whole intricacies of all these different treatments to a layperson that simply wants to look at you and say, man, all you need is zinc and a good immune system. It's like I may as well be talking to the wall. So my friend was telling me he thought that what was going on was maybe an attempt that was made to assassinate the president by somehow spiking this coronavirus, maybe on the debate podium or what have you. Again, back to my college experience, one of the best things that I had learned: do not look for giraffes in your backyard. In other words, if you've got something that's going on, if you've got some symptoms, and then the dog down the road does something else, try to tie those things in together. Don't be looking for some rare autoimmune disease when you have something else that has existed before then. So if you have a virus which has been identified as one of the most contagious viruses known, we sat there and watched this virus start in China. We watched it go across Asia and into Europe. And I guess what really got me interested in studying it and really got me wound up about it was when I was sitting there in February. You can check the timeline and see. Rush Limbaugh, who happens to have a lot of clout, he's got a lot of listeners, he's in a position to influence a number of people. Rush decided, after all this stuff was going on in Europe, when I was watching Italy on lockdown, a country of 60 million, the borders were closed, we were all watching the news and the large tragic number of deaths that were going on over there. We watched that virus go to South Korea and into Iran. We saw the destruction and the devastation across Europe and Asia. And Rush Limbaugh comes out and he says, this is nothing more than an organized effort to remove the president. This is in February. Now I'm looking at a viral disease that's global, that is spread across the world in a very short amount of time. And he characterizes it in his words, it's the common cold, folks. And I thought, that's not a good situation where you have somebody that's got a position of power or a position to impress people because you're in the spotlight. Because what you do is you influence that rippling of the pond by people repeating something that's inaccurate. So fast forward, I'm thinking, how can this be the common cold? It's not the common cold. And why is it not going to be as devastating here in this country as it has been everywhere else across the world? Our air here is certainly not any different. There's no prevention to make sure we don't get the virus, and there's no treatment. So how is it that it won't be as destructive? We got caught in a bad situation. We had a limited amount of testing, so we couldn't identify where the virus was. And in my professional training, they taught us test, isolate, find out where your cases are, isolate them. In a bad situation, test, isolate, and you quarantine. So as far as prevention, there's no prevention. It's a novel virus. We've never been exposed to it before. Therefore, we don't have any inherent immunity. And when you don't have any inherent immunity, the virus runs wild. So what is it that we can do? Well, I'll tell you what we can do. We can sit there and we can put on a mask. That's the first thing that we can do. And back to people of influence and people that have the ability to influence others to do the right thing. Wearing a mask would be doing the right thing. We have a administration right now that is still not wearing a mask. And I'm hearing from my friends that rather than all of these individuals in the orbit of the president coming down with coronavirus, that somehow, yeah, it's probably very likely to be an assassination attempt. And I'm thinking, giraffes in the backyard. If you're not doing the things that you need to do to minimize the chances of what is prevalent, then you're probably a lot more likely to have that as a reason why you're coming down with it. So now you've got somebody in a position of power, in a position of influence, that suggests, let's be cavalier, we don't need a mask, and I don't need a mask, and then you have all these other people who go, yeah, we don't need a mask. I'm seeing people, once again, what we were talking about before, that are totally unaware of the complexities and the intricacies of viral disease and their treatment, saying, let's open up those schools, let's get them back in school, just take some zinc. And those same people, look how long it takes to put this mask on. Now, if nothing else, I'm not going to shed the virus near as much as I would without the mask. As well as I'm not going to take the virus in because this particular mask is one of those talked about N95 masks. But either way, you saw how quick and easy it is to put on the mask. So rather than having enough compassion to put on a mask, a lot of people are suggesting that's a violation of their civil liberties. I don't want to put on a mask. I don't want to go through that 5 seconds to put that thing on and possibly prevent my spreading that virus. It's more important to me to suggest you're violating my civil liberties. What have we come to? And now I've got people that are not only continuing that ideology of not wearing a mask, that have no concept of virology, immunology, how the thing is spread. Now they're talking about it's probably an attempt that somebody has somehow put this coronavirus in there, and that's why it's a problem. This is a major concern, and I don't know how to reach people who have no interest in learning. People that have the expertise in the field. People that have medical expertise should be relied upon for information. When the Center for Disease Control puts out school guidelines that suggest certain things need to be in place, and you have someone who has no medical background that says, you know what, I disagree, and if the schools pay attention, I'm going to withhold funding. Now, one of the things that, again, here in the last few days is a little bit infuriating would probably be the best word, is when the president came down with the coronavirus, again, one of the most contagious viruses around, and then he left Walter Reed, got into a poorly ventilated automobile, exposing Secret Service agents while they took him on a little ride around the block. Remember now, you have people that have had the coronavirus that it is so contagious that when they are dying, their family members are not allowed into the hospital due to the concern of the spread of the virus, where they have to FaceTime. I don't know how many people have FaceTime to watch loved ones die. We're at 215,000. The number's not going down, it's going up. The virus is not any less severe than it was before. The treatments are getting better. But to somehow tie everything to the mortality and the death rate of the virus as being what's the main thing that we need to worry about is extremely misleading and extremely short-sighted. Now, you will notice that Chris Christie has been diagnosed. He went to the hospital. The president got diagnosed. He went to the hospital. First Lady got diagnosed. She went to the hospital. And there will be some others that will go to the hospital as well. Now, how many people have the resources just to drop what they're doing, go to the hospital, pay the hospital bills, and are we so short-sighted that we simply don't care and we're more concerned about infringing on our civil rights to do anything about trying to slow the spread and prevent it? So the idea is mask up, the idea is social distance, and the idea is not for forever. The idea is to do it until at some point, hopefully soon, a vaccine will be made available. Vaccines take an awful lot of time in order to be tested for efficacy, for side effects, and those aren't anywhere near happening. We've got three major companies, Pfizer, Moderna, and AstraZeneca are all doing vaccine studies, and all those vaccine studies in those three have had volunteers with significant side effects and reactions, and that's going to put that vaccine on hold. The last thing I want to do is finish up with this, and I don't want to make this a political statement. What I want to do is make this something where we can talk about disease and viruses and not politicize it. Parvovirus in the dog. A lot of cute little dogs were coming down with that. Now, I can sit there and try to prevent panic and mislead people and tell them, hey, it's really not that big a deal, and go ahead and take your dog to the groomer, go ahead and board your dog. And I can see a lot of dogs dying. But you know, people's pets and immediate family members and just people in general are important enough that we don't want to put them at risk. So if I'm in a position to minimize the loss of life, and I'm in a position to minimize somebody losing something that's dear to them, I'm certainly not going to take it upon me to ignore it. The last thing is this. Parvovirus really started, like I said, in April of 1980, and it's made an impact on me that I'll carry with me the rest of my life. We still vaccinate for parvovirus 40 years later. Dogs still die of parvovirus 40 years later. The virus is just as deadly 40 years later. I am not suggesting that coronavirus is going to be similar. What I am suggesting is when the vaccine came out for the parvovirus, we don't see it hardly at all. But if my phone rings and somebody's on the other line and they say, hey, I'm concerned about my dog, he's vomiting, The first question I will ask them is, how old is your dog? And if they tell me, well, my dog is 3 months old or he's 4 months old, well, the next thing I'm going to ask them, because that's the time when that dog should be getting vaccinated, the next thing I'm going to ask them is, has their dog been vaccinated? And if they tell me no, which oftentimes they do, then guess what? The most likely culprit is parvovirus, that novel virus that showed up 40 years ago. So the Spanish flu hit this country in 1918, the same time of year, March, as the coronavirus hit this year. Most of the deaths and the destruction and the devastation of that Spanish flu did not occur until October and November. That's kind of where we are right now with this coronavirus. I am not suggesting that's what's going to happen, but I'm not suggesting that that's not a real possibility. So at this point in time, if we get one nasty mutation where all of a sudden the virus is more contagious, which that's imaginable, or the virus is able to penetrate and attack the cells easier, or the virus is more virulent toward younger people, then we run the risk of seeing something that we've never even imagined possible. They're already getting second waves over in Europe right now. So for the next 2 months, rather than focusing on violations of civil liberties and things like that, I would suggest you wear a mask, or I would suggest you social distance, or I would suggest you stay home. If you don't want to wear a mask, it wouldn't be a problem if it wasn't a problem for everybody else around you. People that don't really want to care for themselves, that's their choice. But when all of a sudden it starts affecting and infecting other people, at that point, the ideology needs to change. Thanks for listening.